imagined life without your beloved pet? Well, this may be more of a reality than you think. Health officials from across the nation have been warning pet owners about a deadly virus going around called the canine parvovirus, also known as parvo. I work at Community Pet Hospital in Thornton, Colorado, and this season alone we have seen over 40 patients who have lost their lives to this disease. Also, just within the last week, we have 5 new cases of dogs who have come in that have contracted the canine parvovirus. We have been told by health officials everywhere that this virus has been spreading throughout the nation like wildfire. As a client care representative, I feel that it is important to educate owners on what parvovirus is, what it does to the canine system, what the signs and the symptoms are to watch out for, and how it can be treated and prevented. I'd like to start off today by defining what parvovirus is. The American Veterinary Medical Association defines canine parvovirus as a highly contagious virus that affects all dogs. However, unvaccinated and young dogs are more at risk. Canine parvovirus is shed through the feces and can live in the environment for up to 2 years. Dogs come in contact with this virus via fecal-oral contamination or by coming into contact with any part of the environment that has already been infected. Once parvovirus enters the canine's body, it attacks their bone marrow and greatly decreases their white blood cell count. This makes dogs more open to other infections due to being immunocompromised. Once it's done in the white bone marrow, the canine parvovirus moves to the dog's gastrointestinal tract, where it wreaks havoc. It destroys the villi, which is important for dogs to absorb nutrients. Without the nutrients that is needed, dogs become severely dehydrated. The signs and symptoms of parvovirus are illustrated here. There's going to be profuse vomiting, usually with blood present. There's also going to be profuse diarrhea, with also blood present and mucus. The vomiting and the diarrhea also do not help with the dehydration process and makes dogs very lethargic. Due to the amount of pain that the dogs are suffering with their gastrointestinal tract being destroyed, they typically become anorexic and no longer want to eat. To help alleviate these symptoms and the pain for the dog, it is important to make sure if your dog contracts parvovirus that it see a veterinarian immediately. Most of the times, these pets need to be hospitalized for 24 to 48 hours so that they can be placed on IV fluid therapy and IV antibiotics. They also need to be monitored 24 hours a day. Hospitalization can be avoided through the process of vaccination for your pet. This helps prevent the canine parvovirus. The vaccine that is typically used is called a distemper vaccine, or a DA2PP. Puppies that are 8 weeks old should receive their first vaccine at 8 weeks, and then the vaccine should be boosted 2 times 4 to 6 weeks after the first vaccine is given. Once they hit 6 months old, they should be considered fully vaccinated. As with any infectious disease, good hygiene is always important. With that being said, it is important to always wash your hands after dealing with fecal samples. Make sure to keep your yard clean and to not allow your dog to come in contact with any other feces from unknown dogs. It's also important to avoid any contact with any dog whose vaccine history is unknown. This would also include not taking puppies that are 6 months or younger to any places such as Petco, PetSmart, training camps, or playdates. As veterinary medical staff, pets are family to us, and we would love nothing more than to see happy, healthy, furry, 4-legged friends from here on out. Now that you guys have been educated on parvovirus, I would hope that you guys would want the same. So remember, vaccination is the easiest way to help prevent the spread of canine parvovirus. So please inform other people of what this virus can do, and remember that pets are family too.